When my co-founders and I first embarked on this journey, measurement-based care wasn't at the forefront of the conversation. The evidence of its impact in research was profound, but its actual application in clinical practice 10 years ago was very low. Part of the reason for that was the immense burden and manual processes that were needed to implement. That's where Greenspace came in. So now fast forward 10 years later, MBC has very much become a cornerstone of evidence-based behavioral healthcare. And it's moved from a nice to have to essential.
You really can't get to meaningful assertions about the impact of care in a population unless you are collecting standardized, valid, objective sort of data from the population as we're going along. The purpose of this is genuinely to improve quality and lead to better outcomes in care.
So if we approach this as a strict mandate about just monitoring outcomes without any clinically relevant guidance, then this is what some people will continue to use as so-called MBC, but they will fail to realize the benefits.
What we value very much as an accrediting organization is to not just do programmatic-based care, but really doing individualized care within the structure and foundation of programs.
Many providers, all with different skill sets and training abilities and capabilities, oftentimes the mental health literacy, even with your providers, are different across the continuum of care, right? And so how can we have a unified, codified way to communicate what standards are, what evidence-based is? And we've overcome a lot in the last 2 decades around data collection. Now you don't have to have the paper and the pencil and try to interpret and read what the instructions are. I mean, Greenspace can tell you all of that in one button, right? So why would you hesitate to get something set up like that?
Sometimes people sit around and they become paralyzed because they haven't quite figured out the exact strategy, and so they do nothing. I think that it's important to start doing something because of the reach that CARF has in terms of the number of organizations accredited. I think this is an opportunity to kind of kickstart and move the field a little bit faster, and I'm really excited about how there's going to be some intertwining between how do we satisfy these standards and leverage the types of technologies that are becoming more and more readily available.
All of what we know about measurement-based care is essentially a test of augmenting clinical judgment, which ideally is going to include collaboration with one's client.
So by implementing measurement-based care, we noticed that clients were more engaged and they were more interested in collaborating and fostering relationships with our treatment team and providers.
And by doing that, it's also given the opportunity to teach the person served how to be able to utilize these tools and instruments even outside of sessions, to be able to kind of self-monitor and self-correct, which we think is going to have a much more durable impact on the outcome of services.
I think what's really important is to really engage future generations around measurement-based care, how it can be useful, and really making them be experts in the field.
So from my perspective, we're definitely at a turning point, and over the next 5 to 10 years, we're going to see real transformation thanks to the changes that are happening today around measurement-based care, and not just in systems and policies, but the quality of care that people are receiving every day.